everyone, and thank you for tuning into this video. Now, pain is one of the most common reasons people walk into our clinics and hospitals. But despite all of the advances in medicine, millions still live with pain every single day. So, the question is, can we train our brain to manage pain itself? And that's exactly what we'll be talking about. We're going to explore psychological pain management through medical hypnosis and the role of emotional modulation. Pain is not just a symptom, it's actually the number one cause of disability worldwide. It's also a major driver of depression and one of the biggest burdens on healthcare systems. Globally, about 20 to 30% of adults live with persistent pain, and as many of us experience in clinical practice, managing pain with standard pharmacological interventions can be very challenging. Patients today are increasingly open to exploring evidence-based alternatives that can help them cope better and improve their quality of life. Pain can be broadly classified into two categories: acute pain, which starts with tissue injury, usually sharp in nature and has a protective role. Chronic pain, which persists more than 3 to 6 months or continues beyond the point of healing. We can also classify pain by mechanism: nociceptive pain, which arises from actual tissue injury, neuropathic pain caused by nerve damage or dysfunction, and nociplastic pain, where the problem lies in altered central processing without a clear tissue or nerve damage. Let's quickly revisit the pain pathways. When there is an injury, nociceptors are activated and signals are carried via the A delta and C fibers into the dorsal root ganglion. These first-order neurons synapse at the dorsal horn of the spinal cord. The signal then crosses over to the opposite side and ascends via the spinothalamic tract through the brainstem to the thalamus, the brain's relay station. From the thalamus, third-order neurons project into the sensory cortex, prefrontal cortex, insula, and the limbic system. These regions process the quality, intensity, and the meaning of pain. Now, an important point here: a patient's emotional state directly influences pain perception. Stress, anxiety, depression, these increase sympathetic activity and also reduce neurotransmitters like serotonin and noradrenaline, which are critical in descending pain modulation through the periaqueductal gray and the rostroventral medulla. Finally, the gate control theory explains how the spinal cord can either amplify or block incoming pain signals, a key concept for understanding how interventions like hypnosis work. So now that we've refreshed our knowledge of the pain pathways, let's explore what hypnosis is and how it interacts with the emotional modulation of pain. First, let's clear up a few misconceptions. Hypnosis is not mind control. Patients can never lose autonomy and they cannot be forced to reveal secrets. It is not sleep. In fact, brain activity during hypnosis is very different from sleep, and patients awaken immediately at the end of the session. It's not black magic or hocus pocus, and when practiced by trained professionals, it's very safe. And no, I cannot make you cluck like a chicken. What you've seen on TV is stage hypnosis, which is very different. And finally, hypnosis is certainly not fake. In fact, it is a natural state that every one of us experience in daily life. Think of moments when you are driving on the highway and you miss your exit, or when you're absorbed in a movie or a book. In those moments, the outside world fades into the background. That's a natural hypnotic state. Children, especially between the ages of 3 to 8, experience this often in imaginative play. They're deeply absorbed, creative, calm, and focused. This is essentially the same state that we utilize therapeutically. So, how do we define hypnosis? It's a process of guiding a person into an altered state of consciousness, a trance. This is done through relaxation and focused attention. In this state, the mind becomes more open to therapeutic suggestions, which can influence psychological, emotional, and even physiological states. The best analogy is that hypnosis is like a software update. You can only run it when your device is at rest and no other applications are running. Similarly, hypnosis works best when the mind is quiet and focused, free from distractions. There are many applications of hypnotherapy. Today, we'll focus on medical hypnosis for pain management. But it's worth noting that hypnosis works on overlapping neural circuits and can produce meaningful psychological and physiological benefits in a wide range of conditions. Numerous studies confirm the benefits of hypnosis in pain management. In fact, many European medical institutions already offer hypnotherapy as an adjunct for pain, anesthesia, and psychosomatic conditions like IBS and psoriasis. Hypnotherapy is shown to effectively reduce pain intensity in various settings, including procedural pain and chronic conditions, with benefits extending beyond pain relief to improve well-being and self-control. Neuroimaging confirms that hypnosis is a distinct brain state. Using functional MRI and DTI studies, we see greater activation in the prefrontal cortex, anterior cingulate cortex, insula, and the limbic regions, and less activity in the frontal and parietal cortices, which means increased activity in the executive control and salience networks, and decreased activity of the default mode network. EEG studies reveal increased alpha and sometimes theta activity along with reduced beta and gamma wave amplitudes, consistent with a calm, inwardly focused state. Hypnosis influences the pain pathway in two main ways. First, through emotional reframing. It calms the limbic system, reduces fear, anxiety, and interrupts catastrophizing thoughts. Second, through descending modulation. Hypnosis activates the PAG-RVM pathway, triggering the release of endorphins called enkephalins, a natural opioid which inhibits pain transmission in the substantia gelatinosa, the so-called spinal gate. This image shows how psychological and social factors can worsen the pain experience.
Stress from family, finances, or work, along with negative thoughts about the past or the future, can increase anxiety, depression, sleep problems, and even poor posture. All of these feed into a cycle that amplifies how strongly pain is felt. In other words, the brain doesn't just process physical sickness, it also interprets pain through our emotions, thoughts, and environment. Clinical hypnosis breaks this vicious cycle by calming the mind, reducing stress and anxiety, changing negative thought patterns, and enhancing relaxation. So the brain perceives pain as less intense and more manageable.
A successful hypnotherapy session begins with rapport, establishing trust, taking a thorough history, understanding the patient's goals and expectations for pain management is of utmost importance. And each stage plays a significant role in therapeutic outcomes. Sessions must always be conducted professionally in a confidential and non-judgmental way by certified and experienced therapists.
Always rule out organic causes first. Refer for hypnosis when pain resists treatment, has a strong psychological overlay, is functional in nature, when patients prefer non-pharmacological options, or in perioperative care.
Patients may be referred for medical hypnosis when their pain is not adequately relieved by medication, if they cannot tolerate or they are contraindicated for medications or procedures, or if we want to reduce opioid dependence. It works both for acute and chronic pains. Contraindications include severe psychiatric disorders, acute psychosis, or advanced dementia. Although serious side effects are uncommon, patients may occasionally report dizziness, drowsiness, or mild anxiety during the first few sessions. Yes, there can be challenges and limitations. Sometimes sessions can run long, which may interfere with schedules or planned procedures. Costs can be a barrier too, although typically we don't keep patients in therapy for long extended periods. Language is crucial, so we always match patients with therapists who speak their preferred language. Finally, some patients may be reluctant to let go of pain if they perceive a secondary benefit from it. The key always is a strong therapeutic alliance between the patient and the therapist. So to conclude, medical hypnosis is a powerful evidence-based adjunct in pain management. It does not offer a cure, but it offers something equally important: control. By reducing suffering, restoring function, and improving quality of life, hypnotherapy allows patients to live more meaningful lives again.